We're here to talk about bariatric surgery, but bariatric surgery isn't the only answer. And we talk about this being, or people think this is a relatively new thing because you're hearing more about it over the last few years. But how long has bariatric surgery been around?
Well, bariatric surgery per se has been around for more than 50 years. And probably the early operations, which were highly malabsorptive, with a lot of consequences like diarrhea and gas, this is probably what a lot of doctors, older physicians, primary care doctors, maybe even society, feels about bariatric surgery today. They don't realize that the surgery has evolved over a period of time to get away from all those side effects.
Well, in medical school, both you and I learned about the GI bypass, which was one of those malabsorptive surgeries that had some of those problems. Do you think that's a bias that's still out there from the public and from some of the physicians?
Oh, absolutely. The GI bypass was, we're talking about, even before our time, when we didn't have all these wonderful drugs to control cholesterol and things like that. And so that operation, where the intestine was simply shortened, was very effective for controlling this metabolic problems and for losing weight. But over a period of time, obviously, it didn't hold up because of the nutrition, the protein issues, things that even renal failure, kidney failure, and some of these things didn't show for 10 years. So it's sort of a warning to all the new operations that are coming out that unless you have long-term data, we're not exactly sure what those consequences are going to be.
So diets don't work long-term. The surgery you described, the GI bypass, one of the malabsorptive surgeries where you don't digest your food, it kind of runs through you, not good long-term results and some significant risks. What are the newer classes or types of surgeries that are out there?
Well, the evolution of bariatric surgery has changed, and especially in the last 10 years, because it's not bariatric surgery anymore, it's bariatric and metabolic surgery. So it's not just about weight loss, but it's controlling that metabolic syndrome, the things that we talked about before, the things about diabetes, how blood pressure, sleep apnea, that sort of thing. And so we've seen some interesting data recently where patients resolve their diabetes even before they lose weight. And I think you've seen that in a gastric bypass with a band, with other operations. Aren't they working on operations specifically for these things now without losing weight?
Well, a lot of the operations that we do for weight loss help the metabolic syndrome or the metabolic problems. And there's some new surgeries that they're actually looking at for people that aren't overweight for some of these metabolic problems. And some of those hopefully we'll see in the next few years for diabetes, but they're also looking at lowering criteria for some of the bariatric surgeries because the results are so good with some of the metabolic problems.
Well, that's interesting because a lot of insurance companies still use the old NIH classification in order to qualify for surgery, right? I mean, certain BMI range, that sort of thing. But
yeah, and the classification that is out there from the NIH, many years old, but it's what's used, and it's also what's used by most of the insurance companies. And if your body mass index, which is a height and weight ratio, it's not the old just 100 pounds overweight, because obviously that's a lot different if you're 5 feet tall or if you're 6.5 feet tall. And so it's a height and weight ratio. Body mass index, if you're over 40 on your body mass index, potentially you could be a candidate for surgery without having any metabolic problems like the diabetes or hypertension. But if your body mass index is between 35 and 40, then you do meet those criteria if you have medical problems like the diabetes or hypertension, sleep apnea, cholesterol, and so forth. Now they're actually looking at potentially lowering some of those numbers because the results are so good.